Yesterday, the Prime Minister chaired an emergency COBRA meeting. Many of you will have heard his statement on the TV yesterday evening. And of course, as a result of that, people are a little bit more concerned. Lots of constituents have been in touch and are just a bit worried about what they should do. It's clear that the coronavirus, the Covid-19 virus, will continue to spread over the next couple of months. That's what the science predicts, and what we're trying to do is slow down the peak and to have a more even spread, really to make sure that our NHS has got the support it needs and is able to deal with the volume of people who may need to go. It's clear, I think we all know what the symptoms are now. If you have a persistent cough or you have a fever, temperature and a temperature. So at the moment the advice is, if you have a persistent cough or a fever, to self-isolate. You don't need to let anybody in the NHS know, so just self-isolate for 7 days. Future advice is likely to also include households as well. I spoke to Marianne Griffiths, who runs our local hospital, St Richard's in Chichester, the other day, and what she said to me is there was quite a lot of people who were just turning up at the hospital because they had a cough or a cold and asking to be tested, and that's not very helpful. So the first thing you should do is dial 111 or get in touch with NHS Online. And of course, we must keep all the risks continually under review. The most important thing is we're following the scientific advice. There'll be a link on my webpage, which is where you can find the NHS Online, which is the first place of call you should go. In addition, there's been a lot of discussion today. There's been a couple of football matches cancelled. There's been a lot of discussion about large sporting events, whether it's a good idea to go to large sporting events. And I know some people are already introducing social distancing, maybe cancelling parties or not going to some events. And certainly I've had a couple of dinners and events cancelled myself this week as a result of people not wanting to mix with lots of other people. Clearly that's a personal choice, but at this moment, whilst it's still being kept under review, the scientific advice is that it doesn't really solve that many problems, because lots of people will still congregate in other areas, and there's no reason to think that large venues are any more susceptible than those people who you come into close contact with. But they will keep that under review, and of course it's always it's a little bit more difficult to understand when different countries have different advice at different times. But that's because different countries have different rates of spread, and the disease is different throughout a population. And in terms of surgeries, a couple of people have been in touch asking whether they should still attend their appointments, or whether I'm still doing face-to-face surgeries. And I am still doing face-to-face surgeries, but that's up to you. If somebody would prefer me to call them and to have an over-the-phone discussion, then I'm very happy to use the slot over the phone. So individuals must make that decision themselves, but I'm personally still in touch with people. I'm still going about my business in a normal way, but clearly washing my hands for long time, 20 seconds, to make sure that they're clean. I'm washing them much more often as well when I've been on the tube, when I've been from anywhere really, place to place. So today I've just been washing my hands for 20 seconds, singing happy birthday twice, and actually, as it is my birthday today, I did sing happy birthday to me.